Can a PET scan miss colon cancer? False negative. Imagine trying to find a tiny speck in a busy room. Sometimes even the best tools can overlook something important. That's similar to what can happen with a PET scan when looking for colon cancer. PET scans are a helpful part of diagnosing and staging colon cancer because they show areas of increased metabolic activity, which often indicates cancer cells. They use a special radioactive sugar called fluorodeoxyglucose, or FDG, which cancer cells tend to absorb more of than normal cells. This makes cancerous areas appear as bright spots on the scan. However, PET scans are not perfect. Certain types of colon cancer, especially mucinous adenocarcinomas, can be tricky because they don't absorb as much FDG. This means these tumors might not show up clearly, increasing the chance of a false negative. Small tumors can also be missed because they are too tiny to produce a noticeable signal, especially if they are in areas where the background activity of the gastrointestinal tract makes detection harder. Recent treatments like chemotherapy can also temporarily reduce the activity of cancer cells, making them less visible on PET scans. If a scan is done soon after treatment, it might not show the cancer still present but less metabolically active. Technical issues can contribute too, such as patient movement during the scan or respiratory motion, which can blur images and hide small lesions, particularly in the liver or pelvis. It's important to remember that a negative PET scan does not always mean there is no cancer. Doctors consider the whole clinical picture, including other imaging tests like computed tomography or magnetic resonance imaging, and physical examinations. If there is still suspicion of cancer despite a negative PET scan, further steps like colonoscopy, biopsy, or repeat imaging are often recommended to make sure nothing is missed. While PET scans are valuable for detecting metastases and monitoring treatment response, they are not infallible. Their limitations mean they should always be used alongside other diagnostic tools and clinical judgment. Patients should discuss their results thoroughly with their healthcare team to understand what the findings mean for their specific situation. In summary, PET scans can sometimes miss colon cancer, especially mucinous types or small lesions, and a negative result does not guarantee the absence of disease. Always seek personalized medical advice to interpret imaging results and plan the next steps in care.